Discussion and of course looking at your views you sent us earlier. We'll be playing them back, and Dr. Charity Waithima, who is a clinical psychologist, assistant professor of psychology at the United States International University, Africa, and also a practicing therapist, is joining us to answer all your concerns and questions. And Dr. let me begin from where Angina Kirori has just left it. Some of these patients who are already suffering from illnesses associated with mental health, they're finding it really difficult right now to even manage just staying at home and even just manage staying sane, if I may use that word. What would you advise such patients, Dr.
Thank you, Ken. I think like the psychologist who was brought before me said, people who already have pre-existing mental health issues, some of them may be on medication, others may not be on medication. What I would talk to them about is keeping on with the medication, keeping in touch with their doctors or their therapists at the same time. However, we need to know that with this COVID-19 situation, it is going to exacerbate their mental health. And therefore, they need a lot of support from family members, from loved ones, from psychologists or therapists who can support. And therefore, my take would be they need a lot of support because this situation is exacerbating their already pre-existing condition.
All right.
If they're on medication, they need to move on with their medication and to adhere as they get psychosocial support from family and loved ones.
Of course, and you will say during the course of our discussion some of the questions that have been brought forward. That is a major concern for the people who had active lifestyles and now they have to stay at home. But before I go to the individual questions, I'd like to ask you this. The World Health Organization and the United Nations have spoken about mental health, especially at this particular point. What is the reason there's so much concern, even from the Kenyan government, about mental health at this particular time?
This is because many times we can concentrate on the physical health, which has been affected by the COVID-19 or the coronavirus, and we forget that as it is here with us, it brings about complicated mental health issues. And that is why the government and the World Health Organization and all those who are concerned are so concerned about mental health. Because as people are locked in their houses, this is a precursor that can bring about things like depression. A lot of anxiety is being experienced. We also know that people who had underlying mental health issues, it could be bipolar or whatever other mental health issue that was underlying, this would be able to precipitate and perpetuate the mental health issue. And therefore, I'm happy that the government's World Health Organization and all those who are concerned are taking care of mental health issues. We can easily get a lot of people in the populations, not just those who are dying and who are bereaved, but many other people getting affected by mental health issues. And therefore, we need to take care. That's why in psychology, we say there is no health without mental health.
Okay, great. And just the two organizations, World Health Organization and the United Nations, they're also concerned with an increase in domestic violence at this particular time. What would you attribute this to?
Thank you, Ken. You know what is happening. And in fact, I think there is some data that was released by the Nairobi Women's SGBV Center that was saying in March, they experienced about 365 cases of mental health, a rise in March than what they had in January. What is happening, Ken, and everyone needs to understand, as you stay together in the family, this is a new norm, a new normal that we are starting to have. Sometimes spouses have not been together, partners and families have not been living together, and now we've been forced to live together in our small or big houses You wake up and you have to fight the other person, either the partner or the spouse or the children. And therefore, what is happening, people can easily aggress each other and people can easily agitate each other, because before this, even if partners or a spouse was angry with the other, they could easily walk out and take their car and go wherever they wanted to go. Those who would want to go clubbing, they would easily at night go and avoid being there together. Therefore, this has been a precursor again of domestic violence if people are not careful and remember the times that we are in. This is not the normal times we are in.
All right, Daktari, let's go to our first question of the night.
This is Tom here. My question today is, how do you control anxiety headaches, keeping in mind that most of us were used to working for several hours, but now that we are staying at home, we are experiencing anxiety.
Daktari.
Thank you. Thank you for that question. This is normal. When a crisis comes, it comes and destabilizes you. And therefore, some of what you're feeling, the headaches, the anxiety you're talking about, some people are even having panic attacks, is due to the imbalancing that has come with the lifestyle that we are now forced to do. You're not doing what you're used to do. You're not doing what is pleasurable, what makes you excited and what makes you fulfilled. So you're asking, how do I deal with this anxiety? I want to request that we start thinking about COVID as a disease that has come not to add or to finish us, but something that has some positive things about. We've just seen the reports that we've given by Ken and the Ministry of Health. There are several people, the number of people recovering is so high compared to those who are dying. Like in Kenya, we have only reported 14 deaths, while there are 106 recoveries as of today. And therefore, I want to say that let's look at the silver lining. It's not easy when you are feeling surrounded and threatened. However, it's good to know that there is life after COVID, and this is here not to finish all of us, but it is here and it is going to pass.
Well answered, Daktari.
When you see a silver lining, it helps to deal with some anxiety.
Oh, great. All right, let's take the second question, Daktari.
I'm Anne from Nakuru. Okay, my question is, how much news should you consume to avoid mental issues? Yeah, like ukifungua TV kila time ni hizo news mbaya, so everywhere. So how much news should you consume?
I'm Geoffrey from Konoin, Bomet County. Just wanted to ask, how do you cope with information on social media about COVID-19 in such a way that do not affect you in your day-to-day activities psychologically?
All right, Daktari, that question is very clear.
Okay, for the first question, how much news? This is dependent on individuals. We all handle things differently. And if you feel or you see that watching news is affecting you, you need to reduce the watching. Sometimes you can ask someone to summarize for you. If you just need to know, are there more cases? Somebody can summarize for you. However, for you to keep updated, for those who are strong enough and have been able to find ways of coping, you could watch news once a day. That is sufficient. For the stronger ones, we cannot prescribe. You can watch twice, but avoid overexposing yourself with negative news. It could bring about a lot of trauma, anxiety, and all what we are seeing. For the social media, how do we cope with the information? We need to see what we are receiving from social media. Some people are giving news that are not truthful. Some people are giving wrong information that can expose individuals to the coronavirus. And therefore, what you need to do, verify every information. The WHO, the Ministry of Health in Kenya, and other very viable sources of information. That is where we need to get information. And if somebody sends you a forward or a clip, first find out, is this authentic, or has it just been something that somebody has come up with or has been manufactured somewhere? And some of these news are threatening. Others, they are giving false information. For example, I'll give an example. For some time, people confused drinking alcohol and sanitizing with alcohol-based sanitizers, because people were saying because alcohol-based sanitizers were killing or were able to deal with the virus, then drinking alcohol would protect you from the virus.
Okay.
So what I'm saying, sieve what you're receiving, make sure that the sources are authentic, and I would go for getting information from the Ministry of Health website and the WHO and other authenticated sources.
All right, Daktari stays with us because we're taking a short break. We still have a lot